All right, welcome. Today, we're putting on our detective hats. We're going to dive into some really fascinating medical puzzles, decoding the hidden clues our bodies leave behind, from the chemistry of our brains to the rhythm of our hearts.
So, what do these three things possibly have in common? At first glance, they seem totally unrelated, but they're all puzzles, right? Each one is a mystery with a solution that's hidden in the fundamental rules of biology. So, let's get investigating.
Okay, so first up, we're heading into the most complex place imaginable, the human brain. This is where things get tricky, because the clues aren't always something you can see or touch. They're hidden in our behaviors, all driven by this wild dance of brain chemistry. So our first case file, pyromania. It's this irresistible, really powerful urge to set fires. The big question we have to ask is, why? What's actually happening inside the brain to cause this dangerous behavior?
Well, if you look at the brain's chemistry, it tells a pretty clear story. Just think of it like driving a car, right? Serotonin, that's your brake pedal. It's supposed to stop you from doing impulsive things. But with pyromania, serotonin levels are low, so that brake is, well, it's weak. At the very same time, you've got dopamine. That's the gas pedal, the thing that makes you feel rewarded. And it's floored. It's just screaming for that rush. So you've got this incredibly dangerous mix, a foot slammed on the gas and a brake that can't stop the car.
All right, let's look at another puzzle of the mind. Get this. We have a man who is 100% convinced his wife is cheating. No evidence, nothing. He just knows it. But here's the kicker. Every other part of his life is totally normal. He's great at his job, pays the bills, functions perfectly. So what is going on here? Okay, so the diagnosis here is delusional disorder, specifically the jealous type. And the absolute key here is how isolated that delusion is. See, unlike something like schizophrenia, which can really impact a person's ability to function day to day, with this disorder, the false belief is just locked in its own little box, while the rest of their life just keeps on going as normal. All right, we're shifting gears now. We're moving from the puzzles of the mind to matters of the heart. And I mean that literally. We're talking high-stakes, life-or-death situations you'd see in an ER.
Okay, picture this. Code blue. Someone's in cardiac arrest. You look up at the ECG monitor and you see electrical activity. It looks like the heart's wiring is fine. But then you go to check for a pulse, and there's nothing. Absolutely nothing. This terrifying situation is called pulseless electrical activity, or PEA.
So, what do? The protocol is fast and straightforward. First, you start high-quality CPR. Right away, you gotta pump that blood manually. Second, you push adrenaline to try and kickstart the heart. But here's the crucial part. You don't shock them. PEA is a non-shockable rhythm. The real detective work here is step 3. You have to figure out why this is happening and fix that underlying cause. That's the only way to solve this puzzle.
Okay, here's another heartbreakingly common scenario. Someone's having a heart attack. They're on their way to the hospital, but they die suddenly. What's the most common thing that actually causes that? What's the fatal event?
The killer is a rhythm called ventricular fibrillation, or VFib. It's just this chaotic, useless quivering of the heart muscle. It's not pumping any blood. And this is exactly why public access to defibrillators are so important. See, unlike PEA, a powerful electric shock is the only thing that can jolt the heart out of VFib and literally bring someone back to life.
All right, our last heart puzzle has to do with something called the QT interval. Basically, it's a measurement of how long it takes your heart's electrical system to recharge between beats. Now, if this interval gets too long, it's really dangerous. And calcium has a super interesting effect on it. The rule is actually pretty simple. Low calcium makes the QT interval longer. High calcium, on the other hand, makes it shorter. So if you're ever looking for what's causing a long QT, you can immediately cross high calcium off your list of suspects. Okay, next up, we're moving into the world of pregnancy and childhood, where solving these medical puzzles can change the course of 2 lives at once. So imagine a pregnant patient gets a routine blood test back, and it's positive for something called cytomegalovirus, or CMV. And right away, the big, terrifying question is, did I just get this? And did it pass to the baby? But here's the puzzle. That initial antibody test is totally unreliable for timing. Those antibodies can hang around for more than a year, so you have no idea if the infection was last week or last year. So how do you get a real answer? The only way to know for sure is to do an amniocentesis. You have to test the amniotic fluid itself using a PCR test. That's the only way to confirm if the fetus is actually infected. It's the critical piece of the puzzle you need before you can even think about what to do next.
Okay, this next one happens in schools all the time. You have a 5-year-old kid, unimmunized, who's just been exposed to chickenpox. What's the right move? What's the plan? The official guideline here is actually pretty surprising to a lot of people. For a healthy kid, you don't just wait and see. You give them the chickenpox vaccine after they've been exposed. And if you do it within about 5 days, the vaccine can actually prevent the illness from ever happening, or at least make it way, way milder. It's a totally different strategy than what you do for someone who's immunocompromised. Now, this screen right here, this is the famous quad screen for prenatal testing. What doctors look for is a specific pattern. For a pregnancy with Down syndrome, you'll typically see 2 of these markers go down. That's AFP and estriol, while 2 others go up, beta-HCG and inhibin A. But, and this is the most important part, this is not a diagnosis. These are just clues. They get plugged into a formula with the mother's age to come up with a risk score. It just tells you the probability.
Okay, for our final section, we're going to zoom all the way in. We're looking at how disorders are unraveled by looking at the body's most basic building blocks, from individual cells to entire tissues. Here's a case where the puzzle is solved by looking through a microscope. A patient comes in with painful, recurring ulcers. Your first thought is probably genital herpes, right? But the definitive proof, the absolute smoking gun, comes from something called a Zank smear. When you look at the sample and see these classic multinucleated giant cells, bam, case closed.
And now for our final case. It's one of the most devastating medical puzzles there is. Someone starts losing their short-term memory. It just gets progressively worse. So the question is, what is physically happening inside their brain to cause this? The answer is, it's a devastating 3-part attack on the brain. With Alzheimer's disease, you see 3 key things. First, neurons in the cortex are just dying off. Second, you get these sticky amyloid plaques building up between the brain cells. And third, you get these neurofibrillary tangles forming inside the cells. And it all kicks off in the hippocampus, which is the brain's memory hub. That's why memory loss is always the first and most heartbreaking clue. So what have we seen today? From brain chemistry to cardiac arrest, being a clinical detective is really all about knowing the rules of the human body. It doesn't matter if it's the delicate balance of chemicals in the brain, the strict laws of electricity in the heart, or the microscopic clues a virus leaves behind. Every single case is a puzzle, and you solve it by understanding those basic, intricate rules.
And that kind of leaves us with one last question to chew on. We've cracked a few cases today just by knowing some of the body's hidden rules. But think about it. How many more rules are still out there, completely unknown to us? And what incredible puzzles will we be able to solve once we finally figure them out? Thanks for joining this explainer.